We want to focus on what's called anti-core work. That's going to be your best friend in pregnancy. It's going to help with the stability, with the core strength, with the low back.
Welcome to the Vibrantly You podcast. We're your hosts, Megan Martineau
and Caitlin Cipriano. In this podcast, we talk about fitness and nutrition on your motherhood journey. Whether you're trying to conceive, pregnant, postpartum, or beyond, you're welcome here.
Nothing is off limits, and our goal is to support you in this important season of life so that you can feel vibrantly you. As a reminder, this information is not medical advice. Please see the show notes for more details.
Welcome back to the Vibrantly You podcast. In today's episode, we are going to be talking about working out during pregnancy and specifically addressing one of the biggest myths out there, which is not doing abs. So let's dive into this, Megan. Where did this idea of not doing abs come from?
Yes, this is honestly one of the biggest myths that I hear. And I see it on social media all the time of people being like, don't do that, like commenting on someone's video or just giving out poor advice about not doing abs. And likely, I think that this myth stemmed from the fear of making diastasis recti worse. So, if you are unfamiliar with diastasis recti, it is the separation of the rectus abdominal muscles, which are your six-pack muscles in the front of your abdomen. And this is something that a lot of people fear, but it's actually a totally normal adaptation in pregnancy. So, as the baby is growing, as the belly is growing, we need those abdominal muscles to separate to make room for the baby. If they didn't, most people would probably have a problem, honestly. But there is connective tissue that runs in between your six-pack muscles called the linea alba. So what happens is that tissue will stretch and thin out to allow the separation of the abdominal muscles. And then typically once you give birth, your stomach starts to, contract down to its regular size. Everything kind of comes back to the way that it normally was. Now, sometimes postpartum, this does not happen. That's when people are diagnosed with diastasis recti if those abdominal muscles do not come back together. We'll probably do a whole episode on this from the postpartum ones later, but it's not something to fear. And you can actually heal it pretty well with exercise. It doesn't often need surgery. But I do think that that's typically where the fear comes from is people don't want their abs to separate. So they think, okay, I just won't do abdominal exercises in pregnancy. I also think that maybe just a fear of doing something that will hurt the baby. Because again, like the baby's in your belly, that's where your abs are. So I think sometimes people draw the conclusion of like, if I'm doing ab exercises or like say crunches, I'm going to crunch and squish the baby and hurt the baby. And that's not true. I mean, I don't necessarily recommend that you do crunches because that can worsen diastasis recti. But it's not going to hurt the baby. There's actually very little that you can do in terms of exercises that are going to hurt the baby. Really, it's like doing any sort of activities or sports that can cause a direct blow to your abdomen. Those are going to be the things that are unsafe.
Yeah, I think, right, like we are not taught how our bodies function, regularly, let alone what happens with those changes during pregnancy. So people, don't understand like, okay, this is supposed to like separate and make room for things to happen. So I think having that knowledge, it eases some of those like fears that people might have once they know what's really going on. So once you are able to like move past some of the fear, what are some good core exercises people can do during pregnancy that are going to help with benefits, like you mentioned, like reducing the DR severity postpartum, maybe even like some pelvic stability or low back pain?
Yeah, so we can circle back to that diastasis recti concern. So really, in pregnancy, we want to be training the transverse abdominis, which is the deepest layer of your core muscles. Sometimes on social media, you are seeing people calling this like deep core work. And so your transverse abdominis like wraps around your core, kind of like a corset. So it comes all the way into the back as well. And by strengthening your transverse abdominis, this is going to help reduce the chances of having a more severe diastasis recti. And we call this like an injury based diastasis recti. Because, like I mentioned before, everyone's abdominal muscles are going to separate. That's not something we can prevent. But what we're trying to do is prevent the severity of potentially them not closing postpartum. And the way that we do this is by managing intra abdominal pressure. So, our core is a pressure system. I feel like maybe I talked about this before in an episode where we were talking more about 360 breathing. But basically, your diaphragm, your pelvic floor, and your transverse abdominis all work together to manage the pressure in your abdominal cavity. And so, when they're all working together beautifully, we have great pressure management. But sometimes when your breathing can like get a little wonky, or you're doing maybe exercises that do put a lot of pressure on the core, this essentially weakens that linea alba, which I mentioned before, which is that tissue that goes between the six pack muscles. And if that tissue is repeatedly over time for 9 months when you're pregnant, like weakened and having extra pressure, that's when it's going to make it so much harder for those muscles to come back together postpartum. So in pregnancy, we really want to work on managing that intra-abdominal pressure, which means doing your breathing and your pelvic floor work and doing it well. And also just being able to connect to that transverse abdominis, the deep core muscles, so that way they're strong, provide some stability for you. It's also going to help you connect to your abs quicker postpartum. So, with pelvic stability, strengthening the core muscles is going to help with pelvic pain. So, we will talk more in depth about the different types of pelvic pain. I'll probably do a separate episode on each different type of pelvic pain because they're all complex in their own way. But having a strong core can help relieve some of the pressure on the pelvis that leads to these things, as well as supporting the joints. Because when our joints are a little more mobile, there's more movement there, it can cause pelvic pain. And obviously, like, we can't do a whole lot for the actual joints themselves, but we can strengthen the muscles around the joints to provide some extra support. So that's what we're looking to do here with core strength. And it's going to be that transverse abdominis that's going to help with this. And then with reducing low back pain, that's a great thing for core strength as well, because when your core is doing its job, the low back doesn't have to work so hard. And it oftentimes the low back is trying so hard to like stabilize your trunk that those muscles are just so tight, and that's causing some pain. So the stronger your core is, the hopefully less pelvic pain you have and the less low back pain that you have.
Yeah, I've learned so much from you with that in terms of really making sure that you are doing this type of core work to help support yourself during pregnancy and also makes a difference postpartum. If someone is trying to put together some exercises that are going to be supportive of this, what are some things that they can look to include in their workouts?
Yeah, so I kind of mentioned this before, but crunches really would not recommend because that does work your six pack muscles. And obviously, like when you have a big belly, the mechanics of crunches just aren't working, anyways. But that can reduce the risk of that injury based diastasis recti, like we were talking about. So we don't want to do that. Um, Instead, we want to focus on what's called anti core work. That's going to be your best friend in pregnancy. It's going to help with the stability, with the core strength, with the low back pain. And with anti-core work, we have 4 categories. So there's anti-rotation, anti-flexion, anti-lateral flexion, and anti-extension. So with anti-rotation, we're basically resisting the torso rotating. And really what we're trying to resist is like your rib cage and your pelvis. Normally those are like stacked one over the other, right? So we're resisting like the rib cage twisting away from the pelvis, if that makes sense. Um, so these are going to be exercises like a pull-off press. That's where you have a resistance band, you're holding it in front of you, it's attached to something on the side, and you're pressing that band forward and back. And the resistance of that band is trying to get you to turn towards wherever it's anchored. And so you're really trying to resist that resistance and keep your body neutral. Um, and that's going to help with stability. That's going to be a big one. Um, of course, it can be a little hard when you're just listening to this to picture it. So definitely be sure that you head over to my Instagram because I have lots of examples of all of these in video format so you can see what I'm talking about. But that's anti-rotation. With anti-flexion, we're resisting the torso bending forward. So we're basically resisting that kind of like crunch position. And so an exercise that is great anti-flexion is actually a deadlift. And I feel like a deadlift is not the kind of exercise that you would think is a core exercise. But when you're deadlifting, you have that weight in the front of your body, you're keeping a nice and neutral spine. And so, like, think about when you're lowering the weight down on a deadlift, you're basically resisting your back curving and your body like curving forward. So that's where the anti-flexion comes in. And you do need a strong core for that. So that's another one, anti-flexion. The third one is anti-lateral flexion. So that's where you're resisting the body bending sideways. So you can think about it if you're holding, say, like groceries, you're holding a heavy grocery bag in your right hand. Oftentimes we will lean towards that heavy object. So lean towards your heavy grocery bag, kind of bending at the side. Or we will tend to like lean the other way to try to overcompensate for that weight. And so basically with anti-lateral flexion exercises, we're trying to resist the body bending either way. We want to stay nice and neutral while having heavy weight on one side of the body. So a good exercise for this is like a low farmer's carry on one side of the body, or you can do it on both sides. And then lastly, we have anti-extension. And so this is where you are resisting your back arching. So it's kind of similar to anti-flexion where you're trying to resist like that crunch or like folding over. With anti-extension, you're resisting your back arching. So something like a bird dog or a bear hover is going to be a great option for that. So those are kind of the four main anti-core exercises that we like to incorporate in pregnancy. They are safe, they are effective, help with stability, and you can do a lot with these. You can really do a lot of variation to make it fun. One thing that I love about prenatal core exercises is really thinking outside of the box because we do all tend to think about ab exercises as like crunch variations and think that that's the best way to strengthen the abs. And it's really not. And we have a lot of options. So I just think it's fun in pregnancy to be able to like play around with all these different options, find things that work. And I feel like my clients always like it too because they learn something new and they're like, oh, hey, I didn't know that was a core exercise. Or they like feel that their abs are sore after and they're like, that's so cool. And then one other thing is anytime you're bringing weight away from the body, your abs are going to engage. So you could think about something like an overhead press. You're bringing that weight up above your head. Your core needs to stabilize so that you're not like falling over with this weight up above your head. So really anytime you're bringing weight away from your body, as well as unilateral exercises. So anytime you have weight just on one side of the body. So kind of like we talked about before with like low carries, is going to be great to strengthen the abs.
Yeah, these are all such great examples. I feel like have learned so many more core exercises since going through pregnancy. And I used to just do like the same boring things over and over again, and maybe weren't even the most effective. But a lot of the ones that you listed, I feel like my core is like actually so much stronger from doing them, and I have just a better awareness of that type of thing when I'm doing my other, like, non-core related exercises like you were mentioning. Um, if our listeners are trying to, again, like, put together their own prenatal workout routine, what would you say is, like, a good amount of ab work that they need to do on a weekly basis?
So if you're working out like 2 to 3 times a week, which I tend to find is typical for a lot of people who are pregnant, I would try to at least have one ab exercise in each workout. So I guess 3 times a week. So doing like 2 to 3 sets of an exercise for about 10 to 15 reps. And don't be afraid to like repeat the same exercises. Like if you love doing a bird dog, keep it in your rotation. That's great because remember, your belly is getting bigger as your pregnancy progresses. So your body is going to have to work a little harder to stabilize. Your core muscles are going to have to work a little harder to engage. So you kind of naturally have this like progressive overload with your belly. So don't be afraid to just repeat. Like there's really a lot of magic in repetition. And the more you repeat, the stronger you're going to get. It's going to help you move more mindfully throughout the day. And then something else, like outside of workouts, that you can think about is anytime you are picking up something heavy, like I mentioned before, like carrying groceries, treat it like it is a farmer's carry. So think about making sure that your spine is nice and neutral. You're not leaning either way. Your core is turned on. So you can really sneak a lot of these core exercises into your daily activities without doing like a formal workout, which is really nice.
I love that they're so functional. I think our exercises need to be in motherhood. You know, there's so many things like you mentioned throughout your day that we're doing, and our exercise programming can be really supportive of that. So this is really great. I think you provided some really like actionable examples for people that they can get started with right away. And if you love the info in today's episode, please make sure that you are checking out Meg's one-on-one prenatal custom packaging. We'll put the link in the show notes, and you can always follow us and reach out on the Vibrantly You podcast or on one of our individual accounts. Meg is over at Vibrant Mama Wellness, and I'm Caitlin, and I am on Wholesome Huntress Nutrition. And we will see you back here for next week's episode, which is actually going to be my birth story with my first kiddo. So if you are someone who likes birth stories, please make sure that you tune in.